definitely ensconced into the new year. Perhaps your resolution was to do something positive about your smile, your dental care. If that's the case, you're going to love what our next guests have to say and show you. Dr. Todd Shatkin is with, of course, the Aesthetic Associates, and this morning he brought along his two associates who will also be able to show you what they do. But you were saying, Doc, we talk about implants a lot, but you really have a full-service dentistry. We do, Linda. It's great to be here, and I certainly hope spring comes soon because it's just really cold outside. In our office, it's nice and warm, and we'd give you a warm welcome to come to our office and learn about all the different things we have to offer. Not just implants and cosmetic dentistry, but Dr. Diane Witzczak, who's been with me for over 5 years now, and Dr. John Lucchese, who joined our practice last year, but has been a dental icon in Western New York for over 30 years. And we're really happy to have them both there. But they perform, along with me, all phases of dentistry: general dentistry, fillings, root canals, you know, if you have to have a root canal. But everything we do, from Invisalign to fast braces, to, you know, whatever general dental care needs you might have, as well as, of course, the implants and the cosmetic and the reconstructive dentistry.
A family dentistry?
Yeah.
Okay, so we don't talk about children much.
And adults,
sure,
of course.
Absolutely, you know, the whole family, right?
Yeah, for sure.
All right, let's...
And we participate with several insurances, and we do the billing for you, so, yeah.
All right, well, Dr. Witzczak, it's nice to have you here, and Dr. Lucchese, it's great to meet the whole team. Actually, we still have a lot of hygienists back in the office.
We have 3 hygienists full-time working, but...
Not the whole team.
And assistants.
Let's talk about the case that you brought today.
Absolutely. If you look on the screen, the first image is actually was brought to me from a mom who called me on the phone on Valentine's Day night. And she called to tell me that her family was in Rochester at their son's ice hockey tournament, and they went swimming in the evening, and their little girl, who was 8 years old, fell in the pool getting out. So she called me frantically and said, "What should I do?" So she actually took this picture on her phone and sent it to me. And I said, as soon as you get back to Buffalo, please come into the office, and she did. If you look at the next image, this is the image that we took in the office. You can see the severity of the fracture. The good news is that she did not have any discomfort, and we took an x-ray, and she did not, at this time, determine that she doesn't need a root canal at this point. So we said, well, what can we do to make sure that this little girl can smile and be happy and function and eat? And if we look at the next image, this is what we're able to do for her.
Oh my goodness.
As you can see that, you know, she's 8, so she's going to need some orthodontic needs in the future. But at the time, what can we do so she can smile and feel confident? And this is what we do with some bonding. This was done in our office in 40 minutes.
No kidding.
Okay? She was really happy, obviously, to know that she could leave the office like this. Her mother obviously felt so much better knowing that her little girl wouldn't have to walk around with those fractured teeth.
40 minutes.
40 minutes, yes. And she was a great patient in the chair. So it just goes to show, like Dr. Shatkin was saying, the diversity. We can see patients of any age. We can do her orthodontic needs when that time comes. We can do the bonding. People come in all the time with, yes, they need implants, but they also have a lot of cavities sometimes in their mouth that they don't know. And we do everything in our office.
That's great. Like going back to the orthodontia, because I think a lot of people think you automatically have to go to a different dentist. You don't. You know, especially if the kids have already gotten to know you and befriend you. They don't want to go to a stranger.
I hear that all the time. Like, they don't want to go anywhere else. I've been certified to do Invisalign for over 7 years, and the last year or so I've been certified to do fast braces as well. So they don't have to go anywhere else. Once they become comfortable, they can stay wherever they are.
That's great. And Dr. Lucchese, you brought a case as well.
Yes, I did. We brought a case. Is on the screen?
Yeah, we're going to get to it.
We have a case that a patient, you know, had severe decay, abscess, breaking teeth, always in pain, and she just wanted to shy away from that. The next case, you'll see more image of the teeth broken down, a lot of pain and agony.
I would imagine.
She had gone root canals at all these teeth, so we opt to remove all the teeth and to place the implants in a matter of a few hours.
And you know, this goes to show that, you know, don't be afraid, don't be embarrassed to come in.
Yeah, don't think the doctor hasn't seen anything as bad as what I've got.
We've seen everything in our office, you know.
Okay, so you took the teeth out.
Yeah, we took the teeth out. We ended up putting some implants in, and it's called a fixed detachable. The next screen would show it in the mouth. we put the implants in. These are all zirconia bridge teeth, and the patient cannot take these out, but we're able to remove these at every 3 or 4 months to clean everything underneath there. If anything goes wrong with the implants, we're also to check on them and take care of it.
That's
Go to the last slide, if you will, and show the final
Do we have one more picture? Oh,
yeah.
my goodness. And she probably has not had this in her mouth in years and years.
Right.
You know, she hasn't had this kind of a look, if ever.
And she's able to go out and eat and just enjoy her life much more and be able to be more confident in herself.
You know, let's talk about what happens to your health when teeth are decaying at this point. Let's talk about abscess teeth. Very dangerous to let an abscess go.
It's dangerous to have any kind of infection in your mouth, whether it's a dental abscess, if it's periodontal disease, which is very rampant. So many people have periodontal disease, they have no idea they have it. And it could manifest from a little bit of bleeding gums when you floss your teeth or brush, but sometimes you don't even have those symptoms, but you still have the bacteria and the infection. So it's very important. That bacteria can get in your bloodstream, it can go to your heart, it can go to your lungs, it can go to your brain, it can go in your arteries, and it can clog the arteries. It's the same plaque that you find in arteries.
Amazing.
So there's a lot of strong evidence to show that periodontal disease has a very strong correlation to heart disease and arteriosclerosis.
We took a step further. We were doing oral DNA testing, so we got we started doing that in our office to see what different bacteria, the bag bacteria, and trying to accommodate for that.
And to treat it.
And along those lines, we do have now 3 full-time hygienists who are offering those services, and we have an enormous amount of hours between the early morning hours to evening, and of course throughout the whole day. And with the saliva testing, we can identify if there are any problems that are related, then not just to your mouth but to your heart. So if we can get patients in, so we can help them, all the better.
Yeah, and if they have certain bacteria in their oral cavity, then we refer them to the proper physicians to have Dopplers and different things checked to see if they have any plaque in their arteries.
So, the eyes are the windows to the soul, but the teeth in your mouth are the windows to your heart.
And it's all about comprehensive care,
Right. Listen, folks, the Aesthetic Associates Center, that's where you're going to find Dr. Lucchese, you're going to find Dr. Witzczak, and of course, Dr. Shatkin, and so many wonderful people who are out to make sure you are feeling your best and you're doing your best when it comes to oral hygiene, okay?